If you're looking to do everything you can to save your thyroid, in addition to listening to my podcast, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or thyroid. And there will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit SaveMyThyroid.com/newsletter. Hey, this is Dr. Eric, and in this Q&A episode, I am going to answer the question, can I get enough selenium by eating Brazil nuts? So selenium is one of the more important minerals for those with thyroid and autoimmune thyroid conditions. And while it makes sense to try to get as much selenium through the diet, I wanted to discuss whether someone with hyperthyroidism or Hashimoto's can get all the selenium they need through the food they eat, including eating 2 or 3 Brazil nuts per day. So let's start out by answering the question, why is selenium important for optimal thyroid health? So selenium has a number of different functions, but one of the main functions is that it is a precursor to glutathione. Glutathione is the master antioxidant, helps to protect cellular membranes and organelles from oxidative damage. And by decreasing oxidative damage, oxidative stress, it can also help to lower thyroid antibodies. So that's why if you look at the research, you actually see a number of different studies showing that selenium could help lower thyroid antibodies, including thyroid peroxidase or TPO antibodies, as well as thyroid stimulating immunoglobulins. Thyroid stimulating immunoglobulins are the antibodies associated with Graves' disease, and many people with Graves' disease have thyroid eye disease, and those same thyroid stimulating immunoglobulins are what's attacking the tissues of the eyes and causing thyroid eye disease symptoms. And so selenium could also help with thyroid eye disease or some cases of thyroid eye disease. It has other functions with regards to thyroid health, also plays a role in the conversion of T4 to T3. Now, there are other factors as well. So most of the conversion of T4 to T3 takes place in the liver. Approximately 20% of the conversion of T4 to T3 takes place in the gut. So if someone has, let's say, normal T4 levels on a thyroid panel, but the T3 levels are lower, it might indicate a selenium deficiency, but there's also a good chance it could be related to the liver or to the gut. So the next question, how much selenium is commonly recommended by healthcare practitioners who recommend selenium? Because not all practitioners recommend selenium. Usually it's the functional medicine practitioner. I've never known of a conventional medical doctor who recommends selenium, at least on a regular basis. So a standard dosage of selenium is 200 micrograms, and I commonly recommend 200 micrograms as well. Sometimes I'll exceed that. I would say 200 to 400 micrograms. I did interview Dr. Kasha Kynes on the podcast a couple of years ago, and she recommends, I'm pretty sure she said 600 to 800 micrograms, which is a good amount of selenium. And with selenium, you could have a selenium toxicity, so that is a concern. Now, again, Dr. Kynes has been doing it. And again, I'm not sure if she still takes that approach, but at least on the podcast, it sounded like she recommended to most, if not all patients, and didn't have problems. I try not to exceed 400 micrograms when it comes to selenium supplements. So the next question, how much selenium is in an average Brazil nut? And this really varies. It depends. The amount of selenium in a Brazil nut, it's dependent on the amount of selenium in the soil, along with the soil pH. So you could have anywhere, like a single Brazil nut might have 70, 80 micrograms of selenium, which is pretty good. But on the other hand, it might only have 10 to 20 micrograms of selenium. And there's no way of knowing how much selenium is in the Brazil nut when you're eating it. So one of the concerns is that you might not get enough selenium by eating Brazil nuts. If each Brazil nut has 80 micrograms and you're eating 3 of them, then you're getting 240 micrograms, which is great. But if they only have, let's say, 20 micrograms and you're eating those 3 Brazil nuts, then we're talking about 60 micrograms, which might not be enough. Another factor that I want to bring up is that Brazil nuts aren't allowed on an AIP diet. So if someone has Graves or Hashimoto's and they're following an autoimmune protocol, following an AIP diet, then they wouldn't be eating Brazil nuts. Now, of course, there are other food sources of selenium. fish, including sardines, salmon, are good sources, organ meat, mushrooms. So all these are AIP compliant. Again, you're probably still not going to get enough selenium from these to correct a deficiency. And so my recommendation is to try to get what you can through food. But while healing, I do recommend to supplement with selenium in the form of selenomethionine. I should mention that I do eat Brazil nuts on a wellness basis. So I think on a wellness basis, it's fine to rely on food sources of selenium and not to supplement with selenium on a wellness basis. But again, while trying to restore your health, it's a good idea if you are going to try to correct the selenium deficiency. And I'm not going to talk much about that. I mean, you could do testing to determine if you have selenium deficiency. I mean, typically taking 200 micrograms isn't going to be a big deal. If you take too much selenium, though, it can be problematic. So I do have other episodes on the podcast where I talk about selenium. And so definitely you could refer to those. But that is my answer to the question, can I get enough selenium by eating Brazil nuts? Again, the answer is we don't know. It depends on how much selenium is in the specific Brazil nuts that you're eating. So it might be, maybe, but there's no way of knowing. So like I said, as a result, while healing, if you need selenium, I would say to supplement with it. And I would also recommend, of course, to work with a practitioner too when talking about how do you know if you need selenium or not. Again, ideally, I would say work with someone. But anyway, so that's my answer to the question. As usual, I hope you found this Q&A episode to be valuable. And of course, I look forward to catching you in the next episode.
Thank you for listening to the Save My Thyroid podcast. If you haven't done so already, make sure you hit subscribe to stay up to date on the latest thyroid health-related topics. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. Thanks so much for tuning in.
I want to let you know about a product called Hepatoimmune Supreme, which is a unique supplement that has a rare combination of N-acetylcysteine, also known as NAC, milk thistle, and schisandra to support the liver. And it also has a few mushrooms that can help support the immune system, including cordyceps, which has both immune modulating and adaptogenic properties and is great for those with Graves' disease and Hashimoto's. To learn more about Hepatoimmune Supreme, visit SaveMyThyroid.com/liver support.